Good afternoon. My name is Christy, and I'm here today to tell you about robotic assisted surgery. So I'm an LPN. I've been an LPN about 8 years, and I'm going to go back and I'm going to get my CRNA, which is a specialized kind of nurse that helps put patients to sleep so that doctors can perform procedures on them up to and including surgery. A friend of mine recently had to have surgery, and she had to have a robotic assisted surgery. And I've always been really interested in different kind of surgery, so this kind of sent me down a little bit of rabbit hole of research. And I thought, what a better idea than to present to you guys the information that I've learned for this informative speech. So the things I'm going to tell you today are how doctors perform these surgeries, the types of surgeries that are best performed with robotic assistance, and the benefits of having these kinds of robotic assisted surgeries versus a traditional surgery. So the first part is, how does a doctor do that? A doctor comes in and tells you, well, I gotta have surgery and I'm gonna use a robot to help me. You're thinking, a robot gonna help do surgery on me? I don't know about that. Well, that's not necessarily the case. The doctor is highly trained with this robotic equipment. And the surgery is gonna start out like any other surgery. They're gonna wheel you back. They're gonna make these tiny little incisions into your body wherever they're planning on doing surgery at, so they can get these little tools and high definition cameras into your body cavity so they can see exactly what's going on. And then he's going to go to some kind of a computer console or controller system, and he's going to manipulate those in real time, just as he would a regular surgery, but with tiny little tools that manipulate far better than his hands or traditional equipment could. Then at the end of the procedure, he's just like any other surgery, he's going to pull the equipment out, he's going to manually close you up, and then we're going to get you over to post-op, we're going to wake you up, and it'll be just like any other surgery. The three best types of surgeries to have with robotic assistance are prostatectomies, which is a male urologic surgery to remove the prostate. And then there is gynecologic surgeries, which is a radical hysterectomy, which is a female reproductive type surgery, and also cardiothoracic surgeries. Those are the three type of surgeries that are best performed. Now, the benefits of these three surgeries are vast, especially when it comes to a prostatectomy in a male. So the prostate is located between the penis and the bladder, the base of the penis, inside the body and the bladder. And as you can imagine, that's a very tiny place to get into. So the doctor will put these tools and the camera in there, and he can, in a very precise manner, excise the prostate versus cutting you open widely and getting his hands and other big tools in there. He can, precisely excise your urethra and the prostate itself. And the benefits of having that kind of surgery on a prostatectomy is that it helps the men maintain urinary continence, and it also helps them maintain their sexual function. And it also contributes to reduced blood loss in these surgeries. The gynecologic surgeries, the radical hysterectomies performed in females, the benefits of that is a faster recovery time, because rather than having to cut across your entire abdomen to get in and visualize your uterus and ovaries and fallopian tubes and cervix and your lymph nodes that are attached to these areas, they can get in with these instruments and get in and, once again, precisely carve them out and pull them out in one piece. And the benefits of that are faster recovery time, reduced post-surgical pain, which that in and of itself is kind of a given because you're having tiny incisions rather than a large incision, and also reduced blood loss. Now, the cardiothoracic surgery, these are cool. So rather than a traditional heart surgery where they make a large incision down your chest and crack your ribs open so they can visually see everything that's going on with your heart, with the robotic assisted surgery, they make a tiny incision in between your ribs called an intercostal incision, and they put these instruments in there to do a cardiac bypass. Rather than cutting open your whole chest, they can get in there with these tiny tools and bypass your artery and put your heart back together. And a lot of the benefits of this, obviously, was reduced post-surgical pain, because you're not getting your chest cracked open. You're just getting a little tiny cut between your ribs, and reduced blood loss, and the the post-surgical mortality rates, which is your percentage of death, was also lowered with these cardiothoracic surgeries performed this way versus the traditional getting your chest cracked open. So all in all, these surgeons perform these robotic assisted surgeries with a little tiny controller, and they use these tiny little tools which allow for better maneuverability and functioning inside the human body than giant human hands and big tools and equipment. And the benefits of these are, first and foremost, reduced post-surgical pain and reduced blood loss, which leads to a reduced recovery time. And that's all I got to say about that. Thank you so much for watching my video, and I hope you learned a little bit today about robotic assisted surgery. Thank you.